Welcome to the Audrey Hall Show. During this hour, I'll be talking to Tom Mahoney, chair of the Community Preservation Committee. That's the committee that was appointed and charged with determining how the revenue from the voter-approved surcharge on Framingham property taxes will be spent. And that conversation is coming up after we take a deep dive into issues of public health with Bill Murphy. Bill is the director of Framingham Public Health, and he joined the department in late January. He spent 17 years in business and 17 years in public health, most recently as the director of public health in Sudbury since 2014. Now he's filling this important director position, which has been vacant since October. So welcome, Bill.
Thank you for having me.
It's great to have you here and to know that you've taken on this role, an important position that had been vacant since October.
Yeah.
And I'm sure when you came in, there were a lot of things that needed attention. But I'm curious, what brought you to Framingham? How did you decide that this was the next best role for you?
Sure. You had mentioned that my career has been divided between sort of private work and public work. The majority of my public work has been involved in some really nice towns in Massachusetts. I worked for Bedford, Wellesley, Weston, Wayland, and Sudbury, all very good towns. Actually, Framingham gave me the opportunity to work at a city, and I've always felt that my education and training and the skills, I would love to apply doing public health programming in a city.
Because of the size, or because city government is structured different? Which was that?
You know, I love the diversity of a city, and a city can provide. I think we're entering into a period where health equity is going to be a major issue in delivering public health services. And providing those services in a city opposed to a town is much, much different. There are many stakeholder groups in a city, many of which I've started to just meet. So it's really getting to know everybody, all the players and all the stakeholders, and developing a public health program built around the needs of those community members.
So you see opportunity in just making sure that there's equity in delivering health services to the population of people who live, work, and recreate here, or what?
Sure. I think we have an incoming governor that has put a heavy emphasis on health equity, and I think we have to not only look at the inequities that we experienced largely through COVID, which exposed some significant inequities, but we actually also look at the social determinants of those health. I mean, if we provide things like vaccination clinics, are we breaking down the barriers of people to get to those clinics as well? Those things like healthcare, transportation, things like that. So I think we have to dig a little bit deeper in order to maintain a healthy public.
Well, I can see how that would propose some new challenges and some new opportunities, right? Because in a city that's trying to reach deeper into the population and broader into the population, that's a lot different than a small town where the needs are more homogenous and the population is more homogenous.
Yes. I mean, I like to, my first few months, sort of immerse myself in the community, and I've already met with about 10 different stakeholder groups in my first 2 weeks. And what I'm finding is sort of deep commitment by these groups to provide the necessary services to maintain a healthy Framingham.
So what are some of the things you're learning when you're meeting with these folks and learning about their needs?
There's really a problem with attracting people to workforces such as social service agencies, municipal jobs, all those people that provide these services. There's a big gap. So I think we have to sort of address these gaps through many different options. I had an opportunity to meet with our state legislators and senators. They are aware of this problem, so really working with them to build these opportunities to build a workforce that can support the community.
So your department has some openings, and is that what you mean when you say build a workforce?
I will start with sure. I'll start with my office.
Okay.
We're a department of 17, and we have 7 open positions. We need health inspectors. We need community health people. We need a public health nurse. Critical positions to providing services to the community.
Oh yeah, the public health nurse position has been vacant for a while.
For a long time.
So what's the magic sauce? What's the magic potion to get these positions filled?
I think, one of the things that was mentioned is possibly offering free tuition to community college. People want to attend community college. But the community college is set up in a way where we can train a workforce in those deficient areas, make it easier for someone who wants to be a preschool teacher to get that training, make it easier or more streamline the process to be a nurse, because we really need to build those up. That's really a first step.
And those are longer term solutions.
Much
so
longer,
that's not
sure.
going to help you fill your
Sure.
positions right now.
Yes.
Are there any creative recruiting tactics that can be deployed now to help you fill and then to build that pipeline for the future?
Sure. I mean, we're going to look towards the graduating class this year of public health schools and solicit them directly. Let them know that local public health is a great opportunity to, if you have a science background, to learn a very diverse range of topics, if whatever you're interested, food safety, swimming pool, water safety, drinking water, wastewater. You get a really broad range, and hopefully that'll attract more students interested in this field, and also reach out to fields that people looking to change careers. We would look to the food service industry, that maybe there's some people that have a specialty in food safety within the field of food safety, and attract them over too. So we're really trying to broaden how we attract workers.
And at this time, are there agencies that can help you with immediate recruitment needs that you have? Are the traditional methods of advertising working or not working? I mean, I would imagine that coming in to a department that has a staff of 17 and having 7 positions open, you want those filled.
Sure. Recruitment and retention of workers is really our human resource, but we want to really closely work with our human resource department to get creative. Mm-hmm. The state is also now, as they rebuild public health, are providing many training opportunities for someone entering into the field. So I think if we let people know that coming into this field, they're going to be trained with all the necessary tools they need to pick a career that will last them the remainder of their career, I think is going to be attractive. And
do you think that the workforce has been changed because of the pandemic? Do you think it would have been different if it was a couple of years ago? Yeah, I think the jury's out on that one in terms of things I've heard, and I'm curious how it looks to you.
I certainly think there was a certain fatigue that came along with COVID. So if you were close to retirement or looking at all to change careers, that might have tipped the scales. So I did see, I don't want to say a mass exodus, I've used that before, I'm trying not to use that, but there was a lot of people, a lot of very well qualified professionals that left this field. All those people who are typically in positions to train are also not there as well. So we have a younger workforce coming in, a new workforce, without that sort of historical knowledge in place, which is problematic.
Historical knowledge and institutional
historical knowledge, especially in a city like Framingham.
Would you think about going back to some of the people who've left the field and trying to lure them out of, whether it's retirement or reduced work schedule, with some kind of incentives to come and fill these jobs?
You actually see the state doing that quite a bit, that when people retire, they'll retain them as consultants for a certain period of time. And that's something I have to work with the city to do.
I hope you have success, because I know that you want your department to be able to accomplish so much with all of the tasks that fall under your realm of responsibility.
Sure.
The list is pretty long.
It
is. We're still dealing with COVID.
Yes.
How is that playing out at this point in time?
We're still in the middle of the winter season. People are still spending a lot of time indoors, and we have not only COVID, but we have influenza we're seeing increases, and we're all seeing RSV, which is 3 respiratory diseases, the trifecta of diseases that is really affecting the community. So until such time, I think we spend less time indoors, less time in sort of more enclosed spaces, then I think we're still going to see an issue with those 3.
So you mean less time indoors with a lot of people who you don't know, or less time indoors just period?
All those things you learned through the COVID pandemic. Yes, large groups, unmasked, all those things will increase risk. Mm-hmm. So.
Yeah, there's such a thing as COVID fatigue, isn't there?
There is, absolutely. I understand it, and we understand it within all aspects of the community, that people are a little tired of the number of vaccines they have to take and the amount of protocols they have to adhere to. So we don't see as much of those safety guidelines being adhered to.
How much do you hear from the public about COVID? How many people are contacting the department with questions or looking for resources? Is it still something that's putting a heavy demand on your team?
What's interesting, it's not actually a heavy demand on my department, but when I met with these stakeholder groups, they are still seeing a lot of concern about this. They want to know if they go to get a vaccine, whether the whole family can get vaccinated, that the clinic's not just focused on adults or children. And it still seems as if people learn more or people's families are affected and seeing the seriousness of the unvaccinated, that people now want to take the vaccine. So there has been communication with these stakeholder groups to us about those barriers.
Are they asking you for more communications or different ways to communicate, to get their information?
I think they understand the position we're in without having a public health nurse, without having clinics open right now, that the state will send out mobile clinics. So they're communicating to us the need for locations where those mobile clinics might be beneficial.
Okay, and these are the clinics that do the testing?
Yes.
And the vaccines?
Vaccinations, really.
Okay.
The testing clinic is still open, and they can go to their websites to find out where the best places to get those are.
Is this the one at St. Tarcisius?
Yes.
Okay,
Yes.
so that's Beacon.
Beacon, yes.
What is the website? Do you know offhand?
I'm sorry?
But it's Beacon testing.
Beacon testing, yes. It's still
And I think Googling that would put people
yes.
right
Or they can
in.
contact our department. We'll
Or
send
contact the health department
Yes.
at framingham.ma.gov
Yes.
online. Okay, so let's talk a little bit about the cannabis industry. Framingham was pretty welcoming and provided 6 businesses the opportunity to open up along Route 9 in the cannabis, what's called, I guess, the cannabis district. And does that fall under the health department
Sure,
as
we
well?
have regulations that oversee aspects of cannabis. I'm just getting to know those regulations those first few weeks. Our inspectors are seeing that no major problems with what's the sale and access to those products. And we do have routine inspections, and that will be conducted to make sure compliance is adhered to.
What do you inspect for at a cannabis retail location? Do you inspect the items that they're selling? What do you inspect for?
Because it's my my second week, and
Okay.
I'm just getting into sort of immersing myself into the regulations.
Okay,
So,
well, I'll
yeah,
have you back down the
have
road.
Have me back on that.
And we'll touch just briefly on some of these topics now, and then we'll go a little
Okay.
deeper down the road. No
Okay.
problem at all.
Okay.
We understand that. It takes time to really get your arms around all of this. There's a lot.
I also want to make sure I'm giving the public the correct information.
Good,
So,
we like that.
But I can tell you my initial assessment and feedback from my department is there's been no major issues
Good to know.
with those operations.
Good to know. Now, we've recently heard, though, that there are some issues with restaurant inspections that seem, how often, you said routine inspections, and I'm wondering, what is the routine for restaurant inspections?
They're all classified. They have different classifications. Obviously, a convenience store isn't inspected as much as a food establishment store, and we've been meeting those mandated. Typically, you have to get them inspected twice a year. Some of our high risk, we may do more. The low risk, we do less. But I actually had the opportunity to work before I came here, to work for Grant part-time, where Framingham needed support with doing inspections. So even coming as a director, I had the opportunity to do inspections before I got here in a lot of these establishments. And what I'm finding is, there's really a willingness to comply with the regulations, understanding all the different types of ethnic food products and all the different types of food establishments out there. I think overall we're doing a very good job at complying with the regulations and getting information to the establishments that they need to run a safe operation.
Mm-hmm. Now, when you find restaurants that may not be in compliance, whether it be temperature, food not kept at the right temperature, or just not kept in a clean environment or something along those lines, what do you do about that? And what happens does the public get informed about things like that?
You can request any inspection report when you go into a restaurant, and there should be a sign up there that says inspection reports are available upon request. So if a public is concerned or has any wants to do some homework before going out, they can go in and just request and they have to provide that. I always say there's 3 types of establishments. The type that can do the job well, really, and they comply with the regulations. The public should feel comfortable that the majority of establishments are that. There's also the establishments that are just really trying to understand what food safety means and how to protect go a little bit deeper than not just the regulations, but why. And that's when I want my inspectors to take the time to spend as much time in getting the resources they need to understand why that food safety or that regulation is so important. The last one is the people who can do it and just don't do it. And that's the one you want to sort of save for enforcement, that you have to use all type of enforcement techniques, either give a ticket or bring them before the Board of Health. There aren't many of those establishments. And I'll exhaust all opportunities to work with an establishment before going to the enforcement route.
And so when we hear about recalls in grocery stores, whether it be, sometimes you hear about it for fresh produce, you hear about listeria and salmonella, et cetera. Is that something, that's usually something that comes at a larger scale, or do you find those things on the local level and put out warnings like that?
A lot of that correspondence is directly from the FDA, Food and Drug Administration, federally, directly to the food establishment. So that's all filtered down. Certainly, if there's something that's serious that has to be taken off the shelf immediately, then our inspectors get involved and notify those food establishments.
Okay. So, are there any food establishments right now that you're worried about?
I would have to work with my assistant director to get a better understanding, but I don't think so at this point.
Okay. And the people might be surprised to hear about all the different things that fall within the health department.
Sure.
I recently learned that tattoo parlors, and I say the word parlor, but that's an old-fashioned word. What do they call them now?
Body art.
Body art.
Body art, yes, because that comes all different forms. What's interesting is technology is changing everywhere, and it's changing in every industry, and keeping up with that can be challenging. Tattoo parlors were sort of a thing of the past, where you're getting into body art, where cosmetic tattooing is becoming very popular, and permanent eyeliner for someone who might be a cancer patient is very important. So we have estheticians and beauty parlors that want to now get into the crossover and into this body art. So we're seeing more and more establishments like that, and keeping up with those changes can be challenging too for a small department like that.
I would think that the public would be nervous about taking on a new technology like that, so to speak, without knowing whether or not the health department is safeguarding them.
Yes, body art does need to be licensed. If they're not practicing it, they should be licensed by our department. And really the concerns are just meeting minimum standards, minimum health and safety standards, and that they have the proper training and the proper oversight to run a safe operation.
Now, is that something you mentioned? You can go into a restaurant and you can ask a restaurant for their inspection report, but what about body art? Can you walk in and say, I want to see your license, I want to see, what
Typically, that's not inherent within the regulation. So if you're looking to have any type of information, you can contact the Board of Health, do a records request, and we can give you inspection reports of those establishments.
And is that an area where you're seeing the biggest growth? It sounds like, this permanent, what did you call it, tattooing or permanent body art?
I call it microblading. It's really
Microblading.
It's a subdermal, very similar technique to body.
What actually is it?
It's a needle that they put subdermally and inject a certain type of ink. It might not be as permanent as a tattoo. You might have to have it done within every couple of years, but it is a similar operation as tattooing.
So how do you know that the ink that they're using or the chemicals that they're using is safe?
There is an industry, and there's an industry standards as well. So you have to have the proper expertise and training, not only how to apply it, but that the products that you are using are safe, and that the utensils that you're using are properly disinfected and sterilized. And that's what's checked by the Board of Health when we go through these establishments.
So, and is that the same thing for, every corner you look at, there's a nail salon? Is that the same thing for nail salons?
It depends on whether they're doing body art. So.
But nail salons, if they're not doing body art, they don't fall under
Correct. No.
under the.
That's under state. A lot of these are regulated under state inspections. Hairdressers, things like barbers, those are under state jurisdiction.
Okay.
But if you have a concern about any one of them, we can make those referrals to get those inspected if you have any health concerns.
Good to know. Good to know. Now, how many inspectors in a city like Framingham that has so many locations, so many establishments, How many inspectors do you need in order to get in there on a regular basis and make sure everybody's in compliance?
Right now I have 3. I really need 5.
Okay.
And I have a chief inspector that can try to manage sort of where to place those people. We also like to do this rotation where they get rotated a district every while. So you have a fresh set of eyes, but you also want to build in some sort of consistency and standardization of those processes, and we're working on that.
Mm-hmm.
We
Good.
will work on that.
Good. Now, there are a lot of issues we hear about today, especially that have to do with health. Let's talk a little bit about mental health. Let's talk about some of the social issues that have to deal with health and what your involvement is with them.
Sure. We do have some resources in a specialist, an intervention specialist that works with other intervention specialists within the community. The Callahan Center, the Senior Center also has them. So it's really identifying who needs services and getting them connected to services. I feel that a city social service agency should really be resource and referrals. We need to connect those people to the right resource they need to get the help that they need. Actually providing those resources can be challenging because you need very well credentialed people to deal with, mental health issues. So we don't have staffed psychologists and staffed psychiatrists and nurses and mental health professionals. So we need to make sure we identify the problem and get these people connected to the correct services. But it's a growing concern. Again, at stakeholders meetings, such with groups like advocates and SMOC, we're finding that workforce is also depleted. So even there's a limit in resources to connect those people. So we have identified that problem, and again, it's getting the staffing needed to address it.
And recently in the news and in so many communities, we're hearing grave concern over gun safety and gun control and just violence. How does that fit into the broader picture of public health?
I think public health, and especially recently with our workforce, we still sort of reactionary. There's a problem identified and we sort of deal with it after the fact. But really what public health should be is prevention. And I think when you raise issues such as gun safety or racism or women's health as a public health problem, really what you're saying is we need to do a much better job of focusing on prevention. So I think as we move forward, we need to get back to that traditional public health and try to address those issues with preventative measures. Education, training, clinics, screenings, things like that.
How does women's health fall into that prevention category?
That's a relatively newer topic, but giving women access to health care that they need, and that's being denied in certain parts of the country. So it's a newer topic locally, and again, it's on our radar, and we'll look at what's the best way to address those things.
Mm-hmm. When you came into this role and you said Framingham's a city and it's going to have new challenges, and I want that opportunity to work in a city instead of a town, what were some of the things that really attracted you, that you were hoping to get your hands on, that you hadn't been able to get involved with in the past?
I think one of the things is we're seeing this a lot of post 9/11. A lot of money was channeled from the federal agencies down to local emergency preparedness, and I think post COVID, I think what we're looking at, and after you see this national, international emergency, is how locals were critical in addressing a lot of the health care, the needs, yet we were just very unprepared. We didn't have that capacity to deal with all the situations that were being dealt with. I think what you're seeing now is also that same sort of federal commitment, sort of channeling monies down locally to address those problems. So one of the things is there are so many grant opportunities right now. One, as we build a new public health system, we're looking at sort of more regional work. So a city like Framingham really should be a leader in attracting those and applying and getting awarded those grants in order to work regionally to build a model to best address a city, a diverse city like Framingham.
So what kind of grants would you like to be able to pursue?
Right now, we're part of called a Public Health Excellence Grants, and we work regionally with, I think, 7 different cities and towns. We were told that more money will be channeled through those grants. So we want to make sure that we're still getting those grants. As those get built, we want to make sure we're part of that. We're applying for regional tobacco. I mean, restricting youth access to tobacco products is still a major concern we have locally. So we want to make sure we obtain those grants. And then there's a lot of local grants that we can obtain to address social problems. So there are so many different avenues. Grant writing is a job in itself, so it's got to fit into all the other responsibilities we have. Mm-hmm. But I just think there's an opportunity to really almost build a public health system from the ground up at this point in time, post-COVID.
Well, it's interesting that you mentioned tobacco, because as you were saying that, I was thinking, wow, where are we with alcohol, and where are we with cannabis, and is it still just tobacco? It seems like there's so much more opportunity to become more current with, the addictions that people have, or the misuse, I should say.
We certainly want a data-driven approach to those problems. And again, public health wasn't great at collecting that data. And we're much better, they're creating systems now that's all going to be much better tracked in what we do and where those problems are in order to address it. Again, that's another thing that came out of COVID. So the city has received a large sum of opioid money from the opioid settlements. Where do we put that money? We need to really closely look at what's exactly happening in Framingham, and the data is kind of all over the place. What group, what demographic is being affected most? So again, we want to use data-driven approaches to solving those problems.
So if the city has received some sizable grant money for opioids, when you say that, what are we talking?
Hundreds of thousands of dollars, and we will for a period of time.
Right.
And right now the administration is forming groups in order to address that. We've engaged a consultant to try to better understand how to spend that money. All these cities and towns are sort of receiving that money and sort of looking at each other, sort of what do we do with it? But we want to get it, again, looking at a data-driven approach to where best to put that money.
So this all came from the federal level down?
Yeah, and direct settlements with the companies themselves.
Okay.
Yes.
Because there were big lawsuits against
yes.
companies for opioid abuse, and now the funds are there, and there's not a plan yet.
Not a plan yet.
So is the city working with other municipalities on that? Is that a regional approach, or is each city? That's one of
the options. Mm-hmm. I mean, is it better work regionally? Again, that's one of the things that's being looked at.
Sure. Yeah, that's a big one, and there's a lot of them that are really concerning, and you need people to get to make all that happen.
Sure.
How long do you have to spend those funds?
There's actually no timetable at this point, and that's one of the things. So do we let it build up to a certain point where we can maybe hire a bigger department? Again, that's one of the strategies, is just waiting a few years and letting that account build up.
So 6 months from now, or at the end of your first year, what would you like to be able to look back and say you've accomplished?
I want to build a team, and that's, we've said I have a lot of vacancies. What I hope within a year's period of time that would have onboarded professionals, get them properly trained, and start addressing the needs that are there. Right now, we're just really sort of Band-Aid approach to public health, and it's something that has to be addressed.
Well, your success is the city's success, so wishing you great success.
Thank you.
And thank you. We'll have you back to talk about some of that progress after you've been on the job for a while.
Thank you for having me.
Okay. For more information about health issues in Framingham, go to framinghamma.gov. And to email the department, use health@framinghamma.gov. Coming up next, a conversation with the chair of Framingham's Conservation Preservation Committee, Tom Mahoney. We'll be right back.
Where did the time go? Somehow I lost all those years. Where did the time go? I don't know how I got here. Oh, how did I get here?
You've done the hard part. You quit smoking. Now do the easy part and get scanned for lung cancer. If you smoked, you may still be at risk, but early detection could save your life. Talk to your doctor and learn more at savedbythescan.org.
On November 3rd, 2020, Framingham voters adopted the Community Preservation Act. It authorized a new 1% surcharge on local property tax bills to raise and earmark money for open space and historic preservation projects, recreation projects, and community housing development. The state matches a percentage of the funding. So how is that money spent? Well, the Community Preservation Committee was appointed to evaluate the applications and determine which projects would end up getting funded. And Tom Mahoney is the chair of that committee. Welcome, Tom.
Welcome.
Nice to
Thank
have
you.
you here today.
Thank you for having me.
You have been very involved in the city and the town, before it was a city, for many, many years.
Yes.
So, your background.
My wife and I moved into Framingham in 1983, and soon after I got involved in my children's school, building their local playground. So working, helped design it with my background as an engineer. I thought I could.
Which school was it?
Juniper Hill. And the playground actually was named after a state trooper that was killed in I think a helicopter crash.
What was the name? What was his name?
Oh,
Or her
I
name?
can't remember, to be
Okay.
honest with you. But that got me involved locally, and then I ran for town meeting, and I was in town meeting for 10 years. And during that time, I wanted to give back as my expertise as an engineer, so I was on the Public Works Standing Committee from town meeting. And that led me into, I was voted on to the Board of Public Works, a 3-year term. And after that, I was appointed to the planning board when a longtime planning board member, Dana Cunningham, moved out of Framingham. So I was appointed by the selectmen and the sitting planning board. I didn't know it was going to last 18 years, but it lasted 18, almost 19 years.
I bet that's hard to believe.
It is. So in 2018, I retired to take a step back. I think I deserved a little bit like that. Then when CPA came along, I decided to get back involved.
So, you bring all this expertise to a whole new committee that never existed before, for a whole new initiative that was never available before, never existed before. Many people watching may not even know what CPA is, so let's go into that.
Sure. The Community Preservation Act was passed by the legislature. I think it was in 1999 or 2000.
At the state level.
Yes, and it required you could put a surcharge on your tax bills from anywhere from 1 to 3%. But they also required that each community have to go by a referendum vote to adopt the CPA, the act. In 2001, I think it was, Framingham put it on the ballot, and the voters
Didn't pass it.
didn't pass it by a 2-to-1 margin.
But then most recently, which was when?
2020, the city council appointed a study group that was going to prepare a report for the city council to whether the city council would approve putting it on the ballot for another referendum. And I was part of that group, and a few members of our CPC were also involved in that particular study group. And our report was given to the City Council in June of 2020, and they approved the ballot question for the November 3rd ballot. And then we went to work trying to get it passed, to get the visibility out. So I was part of the group, Framingham CPA Now group, that helped get the word out, and we passed it by 2-1 vote.
Big change.
Yes, yes,
Big
it
change.
was.
Big success.
So,
So do you consider this appointment now as the chair of this committee
yes.
as a reward?
I still want to be involved.
Okay.
Okay, I mean, I was also, when I was on the planning board, I was also chairman of the Open Space and Recreation Plan Committee in 2003 and 2008, which was an update to the existing open space plan. So I've been involved almost from the beginning. Okay.
So it's nice to see something that you've had a passion for so long finally come to be and come to be a reality, and then to be able to still be involved, not just in getting it passed, but in actually implementing it.
Yes, that's correct.
Yeah.
So
So in this new role, first of all, you had to get appointed to this committee, right?
correct.
What was this process like?
Process with the way the state law says that it's to be made up of, I think it's 5 to 7 members, to 9 members of a committee. They specifically say there's got to be 5 members which represent boards in town. One is the planning board. There's got to be a representative from the planning board, one from recreation, Parks and Recreation, one from Conservation Commission, one from Historic Preservation, and one from the Housing Authority. And
Any at-large members?
then there are 4 at-large members appointed by the City Council.
Okay.
I'm one of the 4 that were appointed by the City Council, along with Judy Grove, Doug Steffen, and Liz Caprelian. Those were the 4 and we were charged with writing the Community Preservation Plan, which is a guide that we use on all our projects.
So is this guide something that you're following when you're now evaluating projects to see whether they get approved or not?
Yes.
Okay.
Because in the plan, there's a section that we have what are our needs and wants, if you want, and what our needs are. How does it benefit the community? Is it shown, does this particular project show up in all the other master plans in the town or open space plans and things like that? So it's a reference guide for us.
So this is a brand new committee, and with that and the new initiatives and with everyone invested financially, because it's coming out of every taxpayer's pocket locally.
Correct.
I'm sure there's been a lot of challenge getting off the ground.
Yeah, because we're new, there's nothing to go by. From here on, not once we have the plan, it's the foundation of all our work. But we had nothing to go by. So all we could go by was across the state. When we joined, there were 187 other communities that have adopted the CPA. And now, 2 years later, there's been several more added, including our neighbors in Natick. I think Southborough, Ashland, and Marlborough are already, and Sudbury are already part of it. So now Natick and Framingham were the only outliers. Now we're all together as one.
Let's not forget, though, that the state gets involved, right?
Yes,
Because you collect the funds from Framingham taxpayers, but then there's more money.
correct. The 1%, let me just explain where the 1% comes from.
Okay.
It may be a little bit confusing, because all of a sudden it shows up in the tax bill as a surcharge. In the legislation, in the ordinance, it says 1%, and then there was an equation that it's 1% on your taxes, not on your evaluation. So for an example, if your house was valued at $500,000, okay, they take off the first $100,000, so now your taxes are based, for the CPA only, your taxes are based on $400,000. So 1% of your taxes, if the tax rate was 1374, I think was when we started.
Per thousand.
Per thousand. If we took off 100,000, off the top.
If someone's house is assessed at 400,000,
Right.
and you take 100,000 off the assessed value,
Correct.
okay, and then you apply that per thousand rate
Right.
to calculate taxes, then the 1% you're saying is calculated on that?
On the taxes.
Okay, on the taxes.
On the taxes.
Okay, yeah.
And then you divide that on 4 because it's split over the 4 taxes, the quarterly taxes that we get. So like in my case, I think my house is probably evaluated somewhere around 400,000. And I think my taxes was $43
Okay.
for the year.
Okay, so it's helpful for people to know how that is calculated. And
Correct.
then they pay that. It's
Correct.
on the tax bill, and it clearly states that on the tax bill.
Correct. It states as 1%.
And the city collects all of that.
Correct. And
But
at
then
the-
what happens?
Then at the end of the year, end of the fiscal year, which is June 30th, once they certify how much money is in the fund, the Department of Revenue sees that. They see that figure. And along with every other community. And there's a community preservation trust fund that was established during the act. And what it is actually takes, when you sell your home, and as part of some of the fees when you're filing at the Registry of Deeds or whatever, there's like, I think it initially was $10 added that goes into that fund, but I think now it's up to $50 that goes into the state's fund. And then when everything else all said and done, they distribute a certain portion of that monies back to the communities.
Okay, that makes sense. So all these fees that you pay for certain transactions go into a pool, and the state says, okay, we're going to earmark a portion of that pool of money, and we're going to give it back to the communities that have passed the Community Preservation Act as a matching fund.
Correct.
Okay.
And our first year, we didn't have any revenues because we were still new. So we had to wait until our first year of tax bills came in. So last year we had roughly $1.5 million in revenues. The Department of Revenue saw that, and in the equation they said the first match was 30%, I think. So we got
30%?
30% match. So in 1.5, we got $450,000. Yeah, I think it was actually the actual number. I think it was $480,000. And that was determined in November. Well, as part of the last year's budget, the legislature put an additional $20 million into that trust fund. So there was a second award, so that when all said and done, Framingham received $611,000 from the state as the state match for this fiscal year.
That's about half.
Yeah, well, it's not quite, but we had 1.5.
We had okay, so the taxpayers in Framingham put in 1.5, and the state put in about 600.
Right, that's about 38% more. So
That's a pretty good deal.
It certainly is.
You can't get 38% on your money anywhere
That's right.
without a gamble
So-
and some high risk, right?
Exactly. But there are a couple of things that we can do with that money and we can't do with that money.
Okay, let's talk about that.
In the Community Preservation Act, it requires, as you mentioned in your opening, there are 3 areas of concern. I won't say concern, but 3 areas needing protection. Okay, 1, historic preservation. 2, community housing, and the 3rd was open space and outdoor recreation. Those are the 3 buckets, if you will.
Would you separate out open space from recreation and make
No.
it 4, or are they all lumped into 3?
Right now, I think it was in 2010 that the law was modified and they added outdoor recreation,
Okay,
but they didn't change the buckets.
okay.
Okay.
So everything has to fit into one of those categories.
Well, 10%, we're required to designate 10% of our monies that goes into a specific account for those items that cannot be used for anything but those items.
Okay,
And then the remaining funds are unencumbered, if you will, which the committee is free to put anywhere that we feel we need it. So in other words, we have to reserve $217,000 of our monies for each one of those three.
Oh, for each one,
Each
not
one.
total.
Correct, no, each one. So as you'll see in the list of projects, we do not have any housing projects. So that 217,000 has to stay, it will always be in that account.
But it's 217 for each of them. So
That's
it's
correct.
So it's six something.
Correct,
Okay.
right, exactly. But we can
651 or
use, we
something.
can use, because we have preservation projects, historic preservation projects, and we have open space and recreation projects, we can use the monies from those accounts.
So you've got a lot of demands and a lot of things people want all across the city of Framingham.
Correct. We actually had 23 applications initially. The first,
Who can file an application? Anyone?
anyone can, yes, anyone can file an application, but the first thing is a eligibility form to see if it's actually qualified.
Okay.
So we got 23 applications initially, eligibility applications.
What are some of the eligibility requirements? Without going into all the details, though, I mean, because
Does it meet, there are certain requirements of the Community Preservation Act,
okay,
and making sure that they qualify is essentially what we're doing,
okay,
all right? And we determined, and we talked with, there's a Community Preservation Coalition that's a quasi-agency, if you will, that all CPA communities rely on. And
oh, so this is a statewide coalition.
yes, it is.
Who makes up that coalition?
There's, it's actually a membership. Framingham, we did vote to join the coalition, to help fund the coalition.
Is there a membership fee for that?
Yeah, it typically, I think, it's based on your revenues. And I think for Framingham, it was $9,000 a year.
And what do you get for that?
You get their expertise, okay? We ask them all sorts of questions, and they will come out, they will give us an orientation. They have a thing that they call a boot camp or PowerPoint presentation. If we ask them a question about a certain particular project, they'll even help review the project for us.
Great, great.
So,
So you
I
have a
mean-
resource there.
Absolutely.
Okay.
Use them all the time.
How well is the committee working together? You've had some turnover in a short period of time. How's things going?
Right now, it's going great. Everybody's working on the same page, and we're moving forward. We understand what our responsibilities are now. We're under a time crunch because we have to get a.
Was it differing opinions, though, that caused people to come on, to come off?
Well,
There was
well,
some internal, what was going on there?
We had, like any committee, you have some growing pains, if you will. And I think that we did early on, in our first year, we had some resignations from the committee. And I just think there are strong-willed people that we have. And some of the workings of the committee was not going the way they wanted it to go, so they felt the need to resign.
So were some of those strong-willed personalities kind of squashing other personalities, and how did you manage that as the chair?
It's tough.
Yeah.
It was tough. But we were able to move through it, and now we're working together a lot.
Good.
So.
Okay. Let's talk a little bit about the step between qualifying and then actually being considered. You said you had 20, how many?
23.
23 that came in initially.
Correct.
And now you have how many?
We have 11. We qualified, of the 23, we qualified 13 that we said, we believe these projects are worthwhile projects, and go ahead and submit the full application. Because you didn't want them to go through all the,
Right.
there's a lot involved when you're putting together an application.
Yeah, it's a lot of work. It always is.
A
How
lot
did you
of
go
work.
from 13 to 11?
Well, actually, two of the projects, we did go out and ask why they didn't submit full applications. They found other funding sources for it.
All right. So here's a list of the 11 applications you're looking at now, right? Do you want to talk a little bit about Anything specific on this list? What categories they're in? Do you want to mention anything about it, or just leave it up to?
Well, we had several park improvement projects. I think there's 3 or 4 of them. You've got the Chris Walsh Memorial Trail Design, which everyone knows. Chris Walsh, if you don't know, they just received $3 million from a federal grant, and I know they have several state grant monies. They're asking us to help out with the design.
Okay.
So
you had a very healthy list there of 11 projects, and you
Correct.
said now that you have guidelines.
correct.
All right, let's talk a little bit about, you have this list of 11, and you have those guidelines you talked about for approving. What are the guidelines?
Well,
A
does
plan,
it-
you said. You put a plan together, right?
Correct.
Okay.
Does it conform to the plan? There's specific guidelines inside the plan that are in our document. There's a whole chapter that they're supposed to follow. We still have some questions, okay? We have working groups that we have one working group for open space, one for parks, one for historic preservation. A member made up of other members. We wanted to do some preliminary work before we got to the presentation of the projects by the full committee.
Okay, are any of those members of the committee on more than one working group?
Some.
Okay.
Some. We only have 9 members.
Yeah, so you have to
And we
be. Maybe each one has to be on 3 of them, I don't know, but okay.
Well, 9 members, and there's 3 members of the working group.
Okay, so how long, what is the process and how long does it take to get to the point where you're finally going to announce who's going to get this money? Which projects are going to get this money?
Well, we had a deadline of all our applications was November 30th,
Okay,
all right, which left us 3 months to review the projects to the point we are now. Because we're according to the city's ordinance, we need to make our recommendations to the city council by April 1. Okay. Then we started backing out what we have to do to get them to that point.
so out of the money that you have available to grant to these projects, how much of it is being requested right now? More than what you have or less?
Yes.
More.
We have, we've had requests for about 3.1 million. And we're hoping to spend, we don't want to empty our coffers. So actually at our last meeting, we voted not to spend or to keep in reserve for future projects a certain portion of the state match.
What portion?
It's about $300,000 we're keeping for future projects.
Okay,
Okay? There may be some project come in down the line that we could fund if we had additional monies. Okay?
but you're going to get more money every year, right?
That's correct.
Okay, so you still felt the need to keep 300 in there?
Yeah, but just so that we don't empty the coffers. So that leaves us probably, we can't touch the 200,000 from the community housing.
Right, you can't touch,
Right.
yeah,
We
those are
can't touch
required.
that. So, and that 300,000, so we're going to hold back maybe 500,000, let's say. So we have 1.6 roughly that we have the potential of spending.
Okay, so you will bring those recommendations to the city council.
Correct.
For final approval.
Correct.
That happens in the spring, you mentioned that.
Yes.
And then how soon after that does the money get dispersed?
The money, it's for next fiscal year.
Okay, which
So
starts in July?
July 1.
Okay,
Okay?
good.
That's the most, we have to do that because there's still some work to be done. Plus, for budgetary purposes, it's available to us or to the applicants.
Okay, we'll have to have you come back with an update,
Absolutely.
okay?
Absolutely.
This is a great overview and some really interesting projects that we got to take a look at on the list. So we'll have to have you come back for an overview, an update.
That's fine. I'd be willing to do that.
Okay, great. Thank you so much.
Thank you.
Special thanks to Tom Mahoney, Chair of the Community Preservation Committee, and Bill Murphy, Director of Framingham's Public Health Department, for these informative discussions. And thank you for tuning into the Audrey Hall Show, where you will always learn something new.